Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. On the occasion of first craniofacial anomalies and cleft lip and palate conference here at King Abdulaziz Medical City, Riyadh, I'd like to welcome you all to this occasion and to this event. To introduce you to the conference or this program, we have Cleft Lip and Palate program. It was established in 2008. It was in April 2008 by the Department of Pediatric. It was established by a committee chaired by one of the consultants in the department, Dr. Abdurrahman Al-Swayed. This was actually based on recommendation and the mission of our King Abdulaziz Medical City to provide the best care to our patient with this medical and surgical problem. Actually, we are proud to have our support from our CEO here at National Guard Ministry and the team taking care of this Cleft Lip and Palate Center.
On April 2008, the Cleft Lip and Palate multidisciplinary team has been formed with the leadership of the Pediatric Department of the King Abdulaziz Medical City National Guard Health Affairs in Riyadh. The team was formed with the aim to coordinate and provide general guidelines on medical intervention and management for patients with a cleft lip and cleft palate or both. The team consists previously of 10 members and initiated with 27 patients. Currently, the team is being chaired by Dr. Samar Al-Hayek, a consultant in orthodontics in the Dental Services Central Region at King Abdulaziz Medical City National Guard Health Affairs, and consisting now of 13 members and have registered more than 300 patients. Since the institution is very supportive in the Cleft Lip and Palate program, the Chief Executive Officer have approved the creation of the first National Craniofacial Anomalies and Cleft Lip and Palate Center, and it was in May 2013. Consequently, an awareness day has been held on October 2013. In addition to that, the team have lots of activities and support the program for continuous and better services.
Good morning, everybody. It's my great honor and pleasure to welcome you to King Abdulaziz Medical City and to our conference here today. Dr. Al-Hayek has asked me to take you on a trip on memory lane of how this program of cleft lip and palate and craniofacial surgery has started at our institution. This team started in 1998, actual management of patients, and I'd be proud to say that in that year, the first multidisciplinary evaluation of a cleft lip and palate patient and the first multidisciplinary evaluation of a craniofacial surgeon has taken place in our institution here. The first case of total cranioorbital reshaping was done in our institution, and the first case of actually combined cleft palate and maryngotomy and tube insertion was done also in our institution. Prior to that, the plastic surgeon would do the lip by himself, an oral surgeon would do the palate, and then the patient would get lost until he gets to an ENT surgeon who might or might not do a maryngotomy and tube insertion. But after the establishment of that team, patient care for this condition has significantly improved in our institution. Fast forward 17 years, we have a large number of doctors and patients and patient support services taking care of these patients. It made our institution a mecca for craniofacial surgery in the Gulf region, if I didn't say, in the Middle East, and also providing a very high quality care for cleft lip and palate patient. Again, I'd like to welcome you to our city, to our institution, and I hope you enjoy the conference.
When I joined the National Guard Hospital back in 2001, I found out that they had a small cleft lip and palate team, and I offered immediately to join this team. The members were only 5 members, 2 plastic surgeons, Dr. Azzawi, Dr. Thanayan, pediatrician, Dr. Al-Wakil, a speech therapist, and orthodontist. The challenges were very high. They had lots of difficulties, but with a high level of collaboration, compassion, cooperation, and devotion, they were able to provide the best quality of care. In year 2008, after an initiation from Dr. Aswayed, Dr. Al-Muhraj officially launched the first cleft lip and palate team in National Guard Hospital. It was grouping 10 members, all the needed specialists to provide the best quality of care for cleft lip and palate patients. In year 2013, His Excellency Dr. Bandar Al-Gannawi inaugurated the first Center of Excellence addressing craniofacial anomalies and cleft lip and palate patients. It was bringing all the specialties, 13 specialties, under one roof. Our mission as a cleft lip and palate team, and in the future as a center, will be to provide and address all the needs and demands of craniofacial anomalies and cleft lip and palate patients, to facilitate to them the access to care and to provide them the best protocol of treatment using the up-to-date technology.
It is an honor to speak in this first craniofacial and cleft lip and palate symposium. As a genetic counselor, I am involved with families that are faced with this issue in two aspects: the educational part, which involves the formation and why this happened, and the recurrent risk for each family. On the counseling aspect, we are more of a supportive system for the family to cope with such issue that might affect the appearance, which is hard for some individuals.
Coordination and integration of different health care givers is essential, as the management of each and every specialty will influence the outcome or the results of the other. So, since birth, patients with cleft lip and palate are usually followed up by the cleft lip and palate multidisciplinary team, and coordination is done regarding follow-up of the patient with the proper or the needed specialty at the right age. And this is usually done by the cleft lip and palate team coordinator. So the coordinator is usually responsible for making sure that the patient is seen at the right age with the proper specialty. For example, lip closure of cleft lip is usually done more or less around the age of 3 months by the plastic surgeon, and sometimes prior to the lip closure, pre-orthodontic treatment may be needed. So the coordinator will be responsible to make sure that the patient is seen by those specialists at the proper time. Another example of this is the nutritionist. Usually they see the patient at birth, and if the patient requires any special aids to facilitate feeding, for example, special bottles for feeding, or an obturator to make it easier for them to feed, the nutritionist will refer the patient to the prosthodontist. Another example is the speech therapist. They see the patients around the age of 2 years to work with them on proper speech therapy. The orthodontist usually follows up the patient on a yearly basis to maintain the patient's health and to make sure that the proper intervention is done at the proper time. Pediatric dentists, usually they follow up the patient from around the age 1 year or once the first tooth is erupted in the oral cavity to maintain good oral health and to preserve the teeth for as long as possible in the oral cavity. Some of these teeth are considered essential to maintain for as long as possible because they may intervene with some surgical procedures, for example, bone graft.
Our mission will be to provide them holistic care that will be healing their smile, helping them to be integrated in the society.
We are actually having a major plan to go ahead and establish a craniofacial malformation center here at King Abdulaziz Medical City with support of our high authority, and this will go on and launched at the opening of our King Abdullah Children's Hospital near future. We are very proud of this project, and we think that our children here in Saudi Arabia deserve the best care we can provide.